Welcome to the Southwestern Sydney Local Health District 2020 online annual public meeting. We are so pleased you can join us today. I would like to acknowledge that the district delivers its services on the lands of the Dharawal, Darug and Gundungurra nations.
I'm Sam Haddad. I'm the chair of the board. It's very nice to be with you this afternoon. Today we are stronger. We're much more united as a team. We are much more knowledgeable from the experience, and certainly we are ready to move on forwards, building on the experience that we have gained. I also want to recognize the owners of the lands upon which we stand in various locations and pay my respects to past and present. Our priority to continue with strengthening healthcare, building healthcare of the future, the hospitals of the future in the district continues. Almost $3 billion of capital investments. If you go around the district, you can see the sign everywhere of all these facilities being upgraded. 2 giant tower cranes dominate the skyline over the $632 million Stage 2 redevelopment of Campbelltown Hospital. You can look at Liverpool, all the earthwork going on around $700+ million of the health and academic precincts. The MacArthur Community Mental Health Service redevelopment is also complete, and it looks very good, $7 million worth of investments. So basically the work we have completed in the past 12 months is ensuring that our hospitals and services will deliver world-class care well into the future, and this work has continued despite all our efforts in managing COVID and the virus. The number of local health and education jobs, for example, in the Liverpool area alone, will double to about 30,000 jobs by 2036. An area of high attention to the board and to the district is innovation. So from our world-class redevelopments to our swift and agile response to COVID, we are continuing to demonstrate our commitments to innovation. I'm also very impressed that our district is leading 21 research projects relating to COVID-19, and we have more than 420 clinical trials underway, supported by our new Clinical Trials Center. We are also foundational partner in the development of the MacArthur Health Research Center, which will further drive research into the community's most pressing health needs. Transforming your experience and our people is a major focus for the board, and I hope for all of us. This is a major cultural change that we have all to commit to and drive. So across the past year, both myself and some of our board members, we have had the great privilege of meeting many of you, either in person or via technology. So your feedback, passion and ideas, either from our staff or consumer representatives, is inspiring and very important in our decision-making process. Community engagement is also a vital part of our Transforming Your Experience strategy, which is our plan to deliver safe, quality and consistent care to all patients and consumers. From the staff redeployed to our COVID-19 screening stations, testing clinics, and contact tracing teams, to those leading our response in the emergency operations centers and providing care to our facilities and services, you have all made an amazing contribution. John Gordon, I'm sure you all know him by now, he's been on the board for some 9 years. So I want to take this opportunity of sincerely on behalf of the board and I'm sure the ministry of thanking John. Can I in particular also thank our Chief Executive, Amanda. She's demonstrated exceptional leadership during a period of challenge and continuous changes, day after day. Stay well, stay safe, and hopefully we can catch up each other very shortly. Thank you.
My name is John Gordon. I'm Chair of the Finance and Assets Committee. Good afternoon, ladies and gentlemen. In this segment, I'll provide you with a brief overview of our operating results and financial position for our LHD. Our district covers 6 major public hospitals. They include Bankstown-Lidcombe, Barrel District, Campbelltown Camden, Fairfield and of course Liverpool. Our district also includes 14 major community health services and it includes a contractual relationship with 4 affiliated health service providers. They include Braeside, Karitani, the Start Service and the Sydney Southwest Scarborough Service. In terms of scale, there are 15 LHDs across New South Wales. Our LHD, based on size, is first or second in those 15. So we have a significant LHD. Each year we prepare a set of financial statements and these are important as an accountability mechanism for the board and for the management team in view of the significant resources, both human and financial, that they manage on behalf of the state of New South Wales and the people of the South West. The numbers I'm quoting in this presentation are from our audited financial statements. For those who want further detail, a copy of the financial statements will soon be on the Ministry of Health website. So if I'll turn first to expenditure, our total expenditure for the year was 2.1 billion. That was up about 4% on this time last year. Most importantly, we're measured on our ability to achieve budget, to live within our means, and in terms of expenditure, we were within 0.2% of the budget result. So that's a fantastic result given the year we've just had. And our management and staff are to be congratulated for that performance. If I look at the most significant item in our expenditure total, it's $1.363 billion on staff resources. That covers wages, salaries, annual leave, long service leave, and similar things. At 30th of June, we had about 13,500 headcount, which equates to about 11,170 full-time equivalent. That's up about 170 on this time last year. We also received services from visiting medical officers, or VMOs, and this year that cost us $100 million, last year $90 million. Drugs, medical and surgical supplies cost us $171 million. That's down from $177 million last year. The main reason for the fall is a reduction in non-urgent elective surgery, which has been deferred to next year as a result of instructions and advice from the federal government in view of the COVID situation. Depreciation of our assets measures the wearing out of assets over time due to technological or physical obsolescence. The cost of that this year was $72 million, last year was $64 million. That number will continue to increase as we continue to build our asset base across the LHD. COVID has certainly had an impact on the operations of our LHD, and it has a financial impact as well in the last 4 months of the year. The net cost to us was about $31 million, which is mainly attributable to additional staff, resources, PPE, and the cost of diagnostic testing for pathology services. If we look at revenues, the most significant revenue, not surprisingly, was the Ministry of Health allocation, which was $1.9 billion this year. That compares to $1.75 billion last year. The main reason for that increase is funding for capital projects. We have a number of capital projects that are underway in the LHD, and I'll cover those a little bit later. Patient fee revenue is an important source of revenue for us. This year it was $65 million. Last year it was $78.5 million. The reason for the reduction is a fall in the amount of compensation we receive from the private health funds for the use of single rooms in our health facilities. Our net result, if we compare all of our revenues with all of our expenses, was a surplus of $198 million. That compares to a budgeted net result of $214 million, and that's a variance of 8%. Turning briefly to the balance sheet, that shows us the assets we own and operate on behalf of the community, and also the liabilities, the amounts we actually owe to other people, including our own staff and other organisations. The most significant asset group is property, plant and equipment and infrastructure, and that totalled $1.844 billion. That represents land, buildings, specialised medical equipment, car parks, vehicles and the like, all the physical things we need to operate our health service. That's up from $1.7 billion this time last year. And the main reason for that is the expenditure on new capital resources, in particular the new Barrel Hospital, which is almost complete, and stage 2 of Campbelltown Hospital, which is also progressing well. If we look at our total assets and take away our total liabilities, the net worth of our LHD at 30th of June was $1.6 billion. Now, I mentioned we prepare the financial statements as part of our stewardship role for the board and the management team. The statements are prepared by our finance team and they're audited by the Audit Office of New South Wales as the independent auditor. They have issued their audit report and it's an unqualified or clean opinion, and that's the best opinion you can receive. So on reflection on this year, from a financial viewpoint, we've achieved our budget, we've received an unqualified audit report, and that is the best outcome we could ever hope for. Now, this marks the 9th and final time I'll be presenting to you as the Chair of the Finance and Assets Committee. On reflection, my past 9.5 years with the board has been an exciting time, and I'm most grateful for the opportunity to work on this board, and I'm going to miss it. Thank you.
I'm Amanda Larkin, Chief Executive of South Western Sydney Local Health District. Thank you everyone for joining us for the annual public meeting. Can I open by acknowledging the traditional lands that we meet on today across the district, our elders past and present, and those emerging. Can I also take the opportunity to acknowledge the Chairman of the Board, Sam Haddad, our board members, the community who I hope are listening to our virtual presentation today, and especially to all the staff across the district. It is really great to have you all here. As I opened by saying, 1920 will be a year of many memories as we went from the bushfires to floods and then to the COVID pandemic. But I more importantly hope that the memories of 1920 will be about the tremendous work and support that has occurred over the last 12 months. By the end of February, after we had got through the bushfires and the floods, the pandemic started to hit not only New South Wales and across the world, but very much southwestern Sydney. Very quickly, and you will hear today that we stood up our Emergency Operations Centre. We had regular teleconferences with people across the district, and initially daily teleconferences with the ministry. And it's important that we don't forget that over this period of COVID, we've actually maintained a comprehensive health service. Yes, we had to stand down some services and reorientate things, but we've maintained our focus on delivering high quality, safe care to the community of the Southwest. With the PHN, we launched our health needs assessment that gives an extremely good insight in terms of health issues that are impacting on Southwest, where we should focus our health services and where we should target our resources. We did a midpoint review of our strategic plan that demonstrated our vision and our mission for the organisation remains firm and very consistent, and that we're very clear that the things that we've achieved are relevant and appropriate for the district, but importantly also over this time, the work of our redevelopments, which is a very big part of the sites and especially the clinicians and the executive teams. As much as the buildings have been so important in this whole planning phase, what's really important are the models of care. One of the great opportunities that have come out of COVID has been the move to virtual care and telehealth services. Overnight, all of our staff of you, the staff and the clinicians, had to reorientate and think about different ways that we could provide care. And we hope that as we move forward, that becomes central to the way we'll deliver care in terms of the future. So 1920 has been a time of significant change, of significant challenge. But the memory that I hope we take away is the true teamwork, the true commitment to care and delivery, and how everyone worked together to maintain services for our community. I would like to take the opportunity to acknowledge John Gordon, who is stepping down from the board. John Gordon has been with us since the beginning of the LHD and provided great stewardship, great insight of governance, but huge commitment to the delivery of care in the Southwest. I wish him well and know, and I trust he knows, that he will be greatly missed. Now please join us in celebrating this year's award winners.
Now it's time to celebrate our staff achievements and acknowledge our key community partners. This year's 2020 Board's Community Partners Award goes to Dry July, a not-for-profit organisation that raises funds for adults with cancer. They have been recognised for their generous support. Since 2011, Dry July has donated just under $1 million in combination with some of our hospital's associated fundraising efforts. The money was used to purchase items of comfort, such as chemotherapy chairs, light box paintings, a sound system, and other equipment not covered through hospital funding. Congratulations to Dry July! The 2020 Certificate of Appreciation, which recognised the outstanding work provided within our communities, goes to Claudia Haddad from Bankstown-Lidcombe Hospital. Claudia is a long-serving member of the Bankstown-Lidcombe Hospital Volunteer Services and works tirelessly for the Cancer Services Unit. She sells her beautiful knitted and embroidered items at a monthly stall to raise funds for the hospital. The COVID-19 pandemic did not stop Claudia's fundraising. She sold her handmade pieces at local coffee shops and has even had orders for her baby clothes from overseas. The final two awards are part of Transforming Your Experience, recognising excellence in safe and quality healthcare for clinical and non-clinical excellence. The Transforming Your Experience, Excellence in Safe and Quality Healthcare Award, Clinical, goes to Christine Montafia, Clinical Nurse Educator from Camden Hospital. Christine drives truly person-centred care at Camden Hospital, collaborating with her fellow staff and with patients to achieve fantastic outcomes. And the Transforming Your Experience, Excellence in Safe and Quality Healthcare Award, Non-Clinical, goes to Daniel Marson, General Services Manager, Campbelltown and Camden Hospitals. Daniel collaborated with hospital assistants, managers and the Health Services Union to develop a general services workforce plan to ensure the cleaning needs of Camden and Campbelltown hospitals are met. Congratulations to Christine, Daniel and all the winners. On behalf of the board, a huge thank you for your ongoing support.
Hi, I'm Mandy Williams, Acting Director for Population Health. I'm so pleased to be launching the District's 2020 Health Snapshot at this year's virtual annual public meeting. The Health Snapshot is a rich source of southwestern Sydney data that delves into the health of our community. The snapshot highlights health status and lifestyle behaviours, and we can map these over time. Knowing our community is important. It allows the district to target programs and address areas of risk. Southwestern Sydney remains one of the fastest growing regions in the nation, and this is reflected in the total population numbers. 1 in 13 New South Wales residents, or over 1 million people, live in southwestern Sydney, and 42% of these are born overseas. Since 2017, the area has grown by 72,000 people. This trend will continue upwards over the coming years with the growth precincts and airport. The percentage of people born overseas currently sits 11% above the New South Wales average. Physical activity and a healthy lifestyle are major contributors to reducing a range of illnesses and conditions, including diabetes, cardiovascular disease, some cancers and obesity. To address some of the needs of our community, we have some wonderful initiatives, including Go for Fun and the Healthy Children's Initiative, addressing childhood obesity, Quit for New Life, addressing smoking in pregnancy, and working with local councils to create healthy living environments. These free programs help create a healthy society. This year we've been impacted by COVID-19, but we look forward to being able to continue providing these and new options that improve the health of residents of southwestern Sydney. We all have a part to play in keeping our community healthy. I hope you take the time to read the snapshot and also check the district's website and social media channels for some great tips on being healthy at work and at home.
I'm Sonia Marshall and I'm the Incident Controller for the COVID-19 Emergency Operations Centre for Southwestern Sydney. As we came into 2020 and moving out of the bushfire season, we moved straight into early conversations about COVID-19 across China and Europe. This was back in January, and it seems such a long time ago now. And as a district, we've come a long way. We've implemented so many things and we've achieved so much. Back on the 10th of March, we opened our first flu assessment clinics in both Campbelltown and Liverpool hospitals. Around this time, we'd started having weekly meetings with senior executive and senior clinicians across the district, just to keep people informed as to what was happening. Bankstown opened their flu assessment clinic on the 17th of March, and on the same day, our disaster managers took the district executive, the site executive and the clinical directors through a disaster exercise called Exercise Sneeze. Now, Exercise Sneeze was to test our preparedness for a pandemic disaster. And it was at this time, following Exercise Sneeze, that the CE made the call to establish and stand up our first emergency operations centre in southwestern Sydney. So on Monday the 23rd of March, the EOC stood up and we gathered together a team of people from across the organisation to fulfil roles in the EOC. And it was on March 23 that we started to see significant increases in community transmission in southwestern Sydney. Actually, it was the weekend leading into the 23rd of March that our public health unit started seeing between 8 and 10 notifications of positive cases a day. As the incident controller for the Emergency Operations Centre, and with the help of our teams, we were able to start to prepare for what might eventuate and try to anticipate what we might need to have in place in our sites and services and our messaging to the community. From having staff in the right place at the right time, to ensuring that we had enough personal protective equipment, especially in the early days in March and April. There was much to think about and so much to consider. But importantly, we set up a direct line to senior clinicians across the district and our executive teams to both consult and talk through issues and challenges so that we could be as prepared as possible for what might eventuate. We opened our first pop-up clinic in Macquarie Mall in early April, and this was due to some concerns around transmission in the community. And this was when it really became evident to us in the EOC that we needed to actually be in the community testing and not relying on the community to come to us. We had a case in Warragamba and within 24 hours set up a testing clinic within the Warragamba Community Hall. And this is a small community, but they really embraced the testing and we had lines out the door. Droves of people arrived for a swab. During this period, it hasn't just been our sites that have been proactive in their swabbing of the community and staff, but drug health and mental health have played important roles in testing in their vulnerable communities. But I guess what I'm most proud of is that we're able to actually come together to play a role in keeping our community safe. We're in such a great position now. Within hours, we're able to set up and establish clinics wherever they may need to be. As I look back over how much we've achieved, it is actually awe-inspiring. There's no way this could have been accomplished by one person or one team, but it's taken our health community to achieve this. This pandemic has required each and every one of us and each and every one of our staff to engage and to commit to stopping the spread of this infection. And I guess that's what I'm most proud of. So to all of our clinicians, to all of our community, thank you. Thank you for helping us keep our community and ourselves and our families safe.
Thank you.
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 Thank you.